For this week's exam, I decided to do a fluoroesophagram. To prep the room for this, I'll need a cup with a straw, a couple lead aprons for me, the radiologist, and shielding the patient. And then we'll put thick barium in the cup for them to drink. I also have a towel and some water for after the exam for the patient to wipe their mouth and get a drink of water. The goal of this exam is pretty much to get a picture from the mouth to the stomach. The patient shouldn't have eaten. This is an 8 a.m. exam, so the patient shouldn't have eaten since last night at dinner time. So you'll want to double check before you start the exam that they haven't ate since dinner or last night. The exam will consist of a PA oblique, which is an RAO, and a lateral, which we're doing a left lateral for this exam. You'll use a 14x17 cassette. There'll be a 40-inch SID. And if the patient hasn't had barium, you want to kind of explain to them what it tastes like. It's kind of chalky. It's going to be thick. We'll get it done as soon as we can, and then I'll give you a drink of water as soon as possible once we're done with the exam. Some indications for the fluoroesophagram would be trouble swallowing, inflammation of the esophagus, a few more ulcers. There's quite a few different ones that it can be. Before the patient leaves, again, just explain to them that their stool may be an ashy color. That's completely normal. Also inform them to drink lots of fluid to wipe it through their system. So inform them those two things are really important, and to call back if they're having any other complications. Before we start this exam, I'll take a couple spot films. Once the radiologist looks at those and decides it's good, he'll do his part. Then once he's done, we'll do those 3 projections I talked about, the PA oblique, which is the RAO, and the left lateral. Those are all the overheads. And then, just like any exam, you'll remove all the artifacts from the waist up. If they can't remove any of the jewelry, you just make a note of that. And then, I have a male patient, so there's no need to check and see if he was pregnant, but if you have a female, double check to make sure they're not pregnant, no chance of it. And then from there, we can get started. We'll have the patient lay down on their stomach the first time. David? Have them lay down on their stomach. Give them like the edge of the pillow. Scoot down a little bit. Yeah. Give them the edge of the pillow. I'm going to turn their head. Good. Their arms up in a comfortable position. You'll hand them the cup by their mouth so they have the bendy straw towards them. You'll center perpendicular to the mid-sagittal plane, halfway between, in the perpendicular mid-sagittal plane on T5, T6. And then you'll want the top of the light at about the mouth, and then you'll want it collimated down to where you can see their esophagus through here. Okay, and then you will inform them that you'll have them take 3 big drinks, and then we'll take the picture to kind of walk them through the exam as you're going through it. So I will go to my control panel, I'll hit the upper GI button, then I'll hit esophagram, and then I'll walk back out and tell the patient, okay, take 3 big drinks for me. Okay, ready? Drink. And you're watching them as they swallow. Drink, drink, and on that 3rd swallow, take the picture. Beep, and then they're done with that position. So now we'll go into the RAO, which is the PA oblique. Okay, I'm going to have them take the cup from them for just a minute so we don't spill the barium. I'm going to have you raise up this arm just slightly. There. And then bring your left leg up. Okay, and then should be good. And again, you're going right about the mouth on how far up your collimation is going to go. And then you can pretty well see the esophagus as you go through. So you're going to center perpendicular to 2 inches lateral, the mid-sagittal plane, which is here, and then at the level of T5, T6. So you'll center your position there, collimate into where the esophagus is, and then you will give them the cup back. and then you'll explain to them again. We'll do the same thing all over again. The obliquity for this one is 35 to 40 degrees. And then, again, I'll go to the control panel, pick the esophagram, and then watch them take 3 big swallows. So drink, 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 and on that third drink you beep. And then they're done with that one. Take the cup from them, make sure they don't need the towel to wipe their mouth. And then we're going to the left lateral. So, sir, can you put on to your left side for me? Use the very edge of the pillow. Try to make sure their hips and shoulders are in the same plane. Put your hands together like you're praying. Relax your shoulder down. Okay, and then you're not lateral. Try to get their hips and shoulders in the same plane. Scoop just slightly. There you go. Okay, and then on this one, you're centering perpendicular to the mid-coronal plane at the level of T5, T6, and you'll put the light just a little below the mouth on this one, and then you'll collimate down because you can pretty well see the esophagus on this one too. And then you'll hand them the cup back. So just bring your arms out just a little bit so that you can drink. And then again, you take the 3 big swallows, drink, 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 and on that third one you beep. And then they're done. You can give them the water and the towel to let them wipe their mouth, and then again reassure them that their feces will look an ashy gray color, but that's completely normal, and they need to drink the whole glass of water and stay really hydrated for the rest of the night. And then just let them go.